Do you ever feel like you know exactly what you need to do, but you just can't get yourself to do it? Maybe you struggle with focus, procrastination, disorganization, or you feel like your life is more chaotic than it should be. A lot of my clients I work with come to me in their 20s, 30s, 40s, even later, feeling frustrated with themselves, not realizing that what they're experiencing might actually be ADHD. In this video, we're going to talk about what that means, what ADHD is, how it shows up in daily life, and how to begin working with your brain instead of against it. Before we get started, however, I want to say something very important. This video is for education and reflection, not diagnosis. Some of what I share may resonate deeply, but these symptoms can overlap with other things, including medical conditions, hormonal imbalances, trauma, or other mental health concerns. So if this does resonate, I always recommend a full medical and clinical evaluation. Let's start with the bigger picture. Neurodiversity is the idea that differences in how people's brains work are a natural and normal part of human variation. People think differently, learn differently, and experience the world differently. Rather than viewing these differences only as deficits, the neurodiversity perspective recognizes that they often come with both challenges and strengths. The term neurodivergent comes from this framework, and it simply refers to individuals whose brains function differently from what is considered typical. Some examples of neurodivergent conditions include ADHD, autism spectrum differences, dyslexia, dyspraxia, Tourette's syndrome, sensory processing differences. Many neurodivergent individuals are highly creative, curious, and innovative, but most systems like school, work, and daily expectations are designed for neurotypical brains. And that mismatch is often where the struggle shows up. ADHD is a neurodevelopmental condition that affects attention regulation, executive functioning, motivation, and emotional regulation. Executive functions are essentially the brain's management system. They help with starting and completing tasks, planning and prioritizing, organization, time management, emotional regulation, and remembering instructions. A common misconception is that ADHD means you can't focus. In reality, it's not a lack of attention. It's difficulty regulating attention. And that's why someone with ADHD might struggle to start a task, but then hyper-focus for hours on something interesting. Other common experiences include time blindness, impulsivity, and disorganization. And while ADHD begins in childhood, many people, especially adults, were never diagnosed. ADHD doesn't just affect focus, it impacts how you move through daily life. At work or school, people with ADHD often struggle with starting large or complex tasks, meeting deadlines, prioritizing, staying consistent. At the same time, many individuals thrive in fast-paced, creative, or problem-solving environments. In relationships, ADHD can impact communication and consistency. Someone might interrupt during conversations, forget plans, redirect the conversation multiple times, struggle with routines. There can also be emotional sensitivity. These patterns are usually unintentional and reflect differences in executive functioning, not a lack of care. At home, ADHD might look like clutter building up, difficulty staying organized, starting projects but not finishing them, avoiding tasks like chores, finances, or paperwork. Often, it's not that the person doesn't want to do these things, it's that getting started and finishing feels overwhelming. Many people, especially adults, develop ways to hide their struggles, and this is called masking. Someone might over-prepare, rely on anxiety to stay productive, work much harder than others to stay organized. From the outside, they may appear successful and very put together, but internally, they may be dealing with chronic stress, mental exhaustion, fear of forgetting something, and ongoing self-criticism. This is often what people refer to as high-functioning ADHD. ADHD often occurs alongside other conditions, including anxiety, depression, obsessive-compulsive disorder, learning differences, sleep disorders, and substance or alcohol use disorders. To understand ADHD more deeply, it helps to look at a few brain systems. The ADHD brain often needs more stimulation to activate motivation, and that's why interesting tasks feel easier, and boring tasks can feel almost impossible to start. This system helps with planning, organization, and follow-through. Many people with ADHD know what they need to do, but struggle to actually begin or complete it. Working memory. This affects your ability to hold information in your mind. It can look like forgetting instructions, losing track of conversations, or misplacing things. Time blindness. This makes it difficult to accurately sense time passing, which can lead to procrastination, tardiness, or underestimate tasks. Treatment for ADHD is highly individualized. Medication is one of the most researched options, but medication is not the only path. Many people benefit from therapy, coaching, behavioral strategies, environmental supports, and the goal is to find what works best for you in collaboration with a qualified provider. Many people with ADHD have spent years being told they are lazy, disorganized, forgetful, or not trying hard enough. Over time, these messages can become internalized. Self-compassion means recognizing that these challenges are not character flaws. They are connected to how your brain works. Instead of asking, "Why can't I do this?" try asking, "What kind of support would make this easier?" That shift from self-blame to curiosity is often where real change begins. Understanding your brain can help replace years of self-criticism with greater self-awareness and self-compassion. If this video resonated with you and you'd like a copy of the worksheet, including reflection exercises, the self-assessment, and resources, you can send me a message and I'll be happy to share it with you. If you're already signed up for my quarterly love note, it should already be in your inbox. And if you want to keep learning more about ADHD, neurodivergence, and practical strategies to support your brain, make sure to subscribe to my channel. Remember, you're not alone in this, and understanding your brain is the first step toward working with it instead of against it.